Essentially, removing the gallstone and any form of treatment which leaves behind the gallbladder causes the movement of bile to be deranged. Due to this derangement, there is a higher chance of recurrence of gallstones. However, when they recur, we may not be in a position to go back and do the same surgery because that whole area would be different now. The anatomy would have changed and therefore surgery becomes extremely difficult and risky. So, international guidelines state that the best way to treat a gallstone is to remove the gallbladder and the gallstones together. Bile was initially stored and concentrated by the gallbladder. Now what happens is the liver directly produces the bile and the tube called the common bile duct, which was shunting the bile from the gallbladder to the intestine, will continue to do so, but only difference is this bile is much more liquid compared to the bile that was there in the gallbladder. So the patient may not really suffer any major changes in his physiology once the gallbladder and gallstones are removed. This surgery is about 45 minutes to 1 hour depending on the amount of adhesions that are there inside the abdomen. We advise the patient not to take a fatty meal before and after the surgery. We ask them to consume a lot of water and to come without consuming any food for the last 12 hours before the surgery, and then we can perform the surgery easily. Since gallbladder stones are asymptomatic, they really cannot know when they have started forming. They can form anywhere between 3 to 5 years before you have actually found out about gallbladder stones. The best way to prevent it is any abdominal pain that you feel in the upper part of the abdomen, please go and show it to your doctor. If it is diagnosed to have a gallbladder infection, then that has to be treated vigorously because that is a precursor for formation of stones. Have a low cholesterol diet because the cholesterol, if it saturates in the bile, that's when gallstones form. A biliary colic or an attack on the infectious attack on the gallbladder would be essentially a painful condition wherein the pain is more focused on the right upper abdomen. The pain is so severe that the patient is incapacitated for maybe a few minutes, sometimes up to a few hours. Patient is unable to even eat during that duration or consume water. Once the pain subsides, the patient is able to resume his regular work. This pain may be associated with vomiting, may be associated sometimes with fever, may be associated with difficulty in breathing also, depending on its severity. No, gallstones cannot go away without surgery. Only exceptions to this case are very small gallstones can somehow slip out of the gallbladder and get stuck into the common bile duct, which is the duct which is connecting the gallbladder to the intestine. This may in future grow in size and completely block the common bile duct, therefore causing jaundice and severe infection in and around the liver, which is a very difficult condition to treat and causes intense discomfort and pain to the patient. If something slips out of the gallbladder and enters the intestine, there is a possibility that gallstones can pass out through stools. There is a condition called as gallstone ileus, wherein if a large stone enters into the intestine, it may get stuck at the junction of small and large intestine, causing obstruction or pain in the abdomen. Do not take any fatty food because the consumption of high cholesterol meals or high caloric meals triggers the gallbladder to act, to pump out the bile which is present inside it. When that is done, it also causes a disruption in the bile flow, and this disruption essentially equates to an infection that may be caused in and around inflammation and infection that can cause cholecystitis. Gallbladder polyps are commonly seen in scans which are done for other various reasons. When an abdominal scan is done, then we pick up gallbladder polyps. Polyps are nothing but an extra growth of tissue within the gallbladder which may or may not be benign. Most of these polyps are benign conditions, however, this may become malignant at a later stage. Therefore, if you find gallbladder polyps, please consult your surgeon, and based on your history and other conditions, you may or may not require a surgical intervention for this condition.